Hey.
It worked.
Oh my
Oh my
goodness.
gosh.
Oh,
That
thank
was
you for trying
that
so hard.
was painful.
Yeah, I know. I'm like, I'm sweating.
Oh,
Am I gonna Marianne? Everybody's expecting it, and yeah. Anyway, so thank you so much.
I'm glad. Thank you to all the people who stuck around and came back after all those false starts. So I am on my phone because I was able to update it on my phone easier. So
Okay, good.
anyways, it's all, you should see how I've propped this up. I got four books and a
Oh
chair,
yeah.
and anyway,
Take a picture.
it's
Take a
all
picture.
good. Yeah, I will. I
So,
will send it
all
to
right.
you.
So a lot going on.
Lots
So
going on.
yeah,
Lots going
let's talk.
on.
I mean, 99% of my questions will be about vaccines today. So
Okay.
yeah,
That's
today,
all good.
yes, it is. It's very good news. Today, Halton online booking system launched for COVID-19 vaccines. What do people need to know?
Okay, first thing is that it's only open for folks who are 80 and older, and that's anyone born in 1941. Doesn't matter if your birthday's in December. If you were born in 1941, it doesn't matter if you're 79 right now. If you're turning 80 this year, you are eligible. So,
Okay.
1941 year of birth, you can go online and book your appointment, and or if you have trouble with technology, then you can call 311. And we are please asking people, if they are not eligible yet, please don't call. We don't want to overwhelm the system. And what I have seen so far is that the system is working really well. I've gotten lots of feedback on my social feeds today, as well as an email, that it's working seamlessly. So let's keep that up.
Okay. And then I got to ask, because I mean there are obviously people that don't have a computer, but there's a lot of people too that might not have access to a phone just because they're older, they might not know how to speak English, like kind of like. So is there any? Will you be going? Will Halton Public Health be going out to doing vaccines to people over 80?
So they will be trying to reach those populations by a number of different means, mail. Some of them they would probably already know through other channels, like if it's a language barrier, through, say, the Halton newcomers. So our public health unit really has a really good handle on getting in touch with isolated folks, because they do it all the time for flu season and for other things. So they will do an outreach to the community and make sure that those folks have a way to get to the vaccination center. So, and if you need a ride, there is free transportation being provided. So book that when you book your appointment, there and back.
Okay. And sorry, Marianne, how long do I have you? Just because I know we started late and I
Oh,
know
we
you're.
got, I, you have me for the full half hour.
Oh, really? Okay, okay, okay.
Lucky you. Yeah. So
Okay,
I don't
good.
know what time that is. I don't know when we got started, but yeah.
I think I looked at it. It was 4:19, so it took us 14 minutes to get ready, but we did it. So, all right.
Persistence.
How many vaccinations do you plan on doing a day in Burlington or in Halton? Do you have those numbers?
So we've been told to plan, every public health unit has been told by General Hillier, the chair of the provincial task force, to plan for at least a minimum of 10,000 per day across a health unit. And so that's all the locations. And we'll ramp up to that, of course, but they're now being planned for about 300 a day. There are 5 locations. You can go anywhere in Halton. So whatever the most convenient one is, even if it's, say you're living in North Burlington and it's easier to go to Milton or Oakville, you can do that. You don't have to go to the Burlington location. So they will ask you for your postal code when you're booking the appointment, to make sure that we're only dealing with Halton residents in our Halton Public Health Unit. And there's another site that was just announced, of course. Joseph Brant Hospital Pandemic Response Unit is going to be used for vaccinations as well.
Okay, perfect. And then we talked about region hopping, but there might be vaccine hopping from what I mean. We're looking at Toronto, right? They're not set up yet. They might not be set up till a couple of weeks, right? So I mean, are you afraid of kind of vaccine hopping coming to Halton?
Well, they'll handle that on the initial booking appointment. So you have to put in your postal code and to make the appointment. And in fact, we had some folks whose postal live in the rural area that had their postal code changed. So when they went on to book, the system hadn't been updated quite yet to recognize their postal code. So they weren't even allowed to book an appointment. So that's how we're going to deal with making sure everyone stays within their own public health unit. And anyway, so that's been fixed now. If people revert to their old postal code and enter that, then and the system will get remedied within a day or so, I'm sure. So you'll be able to book, but it will recognize if you have a Halton postal code, and ID, of course, will be checked at the door. So.
Okay. And then I guess what is the next age range in regards to vaccinations?
70 plus. They go down 10 years, so everyone can calculate roughly when they're going to get vaccinated. I'm a ways off, thankfully.
So, but do you know when 70 plus will happen?
It all depends on vaccine supply, right?
Okay.
And we're not in control of that. That's the federal government to deliver the supply. And of course, Halton Region, about 2 weeks ago at council, issued an urgent and politely worded resolution to ask the federal government to, get on the supply piece, because we're ready. Our centers are open. We're ready to go. We're booking people, and it all depends on having the vaccines come in. So, there's good news. We obviously heard the new AstraZeneca vaccine was approved by Health Canada. That will open up a whole nother supply chain to get more vaccines in. So it should start picking up now, but it's been a lot of hurry up and wait.
This is a good segue. I was going to ask about the AstraZeneca vaccine. Obviously, it's not, I think Health Canada said that it's not suitable for 65 and over. So does that open kind of the door for kind of frontline workers, factory worker, warehouse workers to get the shot sooner?
Absolutely. For sure.
Oh.
Absolutely. I mean, if we've got vaccine or access to get vaccine, we're going to get it, I would hope, and get it to as many people as we can with it, because the priority groups, as you know, includes more than 80-year-olds. That's sort of the general population, but there's lots of other folks like frontline workers in that second phase of priority. So they're already in there and they can use those vaccines. So obviously the public health unit and the staff administering will make sure that the right vaccine gets in the right arm.
Okay. Perfect. You're going through these vaccine questions really fast.
I've been talking all day, so I'm like talking really fast now.
Probably
you said you had a lot. Okay, go.
Some jurisdictions are targeting seniors in high-risk neighborhoods and more vulnerable neighborhoods. Will Burlington and Halton be kind of sending up mobile vaccination centers to these neighborhoods?
Eventually, there will be the ability to have mobile clinics. They've done that already for some of their long-term care and retirement homes, so that will continue. And of course, in time, but it all depends on supply, getting it right at your pharmacy. So, hope's on the horizon. Good news is coming. We just need to get those vaccines shipped to us, and then our staff know how to distribute them to make sure that as many places we can get them to safely to get them to people, that will happen over time.
Okay. I talked to Mayor Brown last week, and he's willing to open up a 24-hour vaccination clinic if supply obviously holds. Is that something that Halton and Burlington is looking at? So
we will do whatever we need to do to get people vaccinated. So, Halton Region staff have hired, I think at last count, over 400 people to deliver this program. They're providing free transit, but we're waiting, for vaccine supplies. So, we'll do whatever we have to, but I'm guessing most of the population, when they book an appointment, will want to come at a reasonable hour. Now I'm a night owl, so I'm a night owl and an early bird, which means I don't get much sleep.
Yeah, true.
I'll come whenever.
If they said 4 a.m., Khaled come in, I would be there. So
I'm sure a lot of people would, right? Yeah.
What do you think of this vaccine hesitancy? Like, I mean, should I assume that when it's your turn, you're going to get a vaccine?
Absolutely.
Yeah. So
Absolutely.
What are your thoughts on that? Like people saying that I'm not getting it?
So, people will have to make an individual choice. There's no vaccines that are being forced on anyone, but it is safe. And so if people are concerned about whether it is safe, then I beg them, please talk to a health expert. Don't get your information from Facebook. Don't talk to your Aunt Nancy, as wonderful as Aunt Nancy may be. Talk to the health experts and assuage your fears. They will be able to tell you that it is safe, and it will help you help keep you safe and help keep the people around you safe. So I do encourage everyone, unless they have a medical condition, and there are some, but that's a conversation for you individually with your doctor. If you have any condition that might be, that might not be a good idea for you to get the vaccine. But the vast majority of us are not in that, and the hesitancy, I think, comes out of misinformation that's out there and fear. So let's deal with that and make sure that that's not a barrier, and make sure that everyone feels comfortable getting this, because it is safe. It's gone through many trials internationally, globally. This has probably been this has been for delivery of a vaccine, the minds around the world that have gone into this through open data and cooperation, because everyone recognized that the issue is speed. It's not who gets to develop it first. So people were not proprietary and hoarding scientific research and information. So we got it quickly, but it got vetted through, all across the world, the best minds on this. So it is safe, and part of the reason, I'll get it no matter what, but I will probably take a picture of me getting it so folks know that I'm not afraid of it, and you shouldn't be either.
Cool. Yesterday, Halton Region reported 13 confirmed COVID-19 variant cases of concern. How concerned are you about that?
So it's always a concern when we see these variants, because it says that the virus is still mutating and active out there, and we haven't kind of kicked it to the curb yet. That being said, if you are protecting yourself from COVID, then that works for the variant. So all the measures that work for garden variety COVID, masking, washing your hands, keeping 6 feet away from anybody you don't live with. This is not the time to relax on those measures. Don't go socializing with people. Don't go hanging out. Make sure that when you are near somebody inside or outdoors, if you're closer than 6 feet, first of all, you shouldn't be, but if it's unavoidable, keep your mask on and follow all of those health directives. And if we do that, then we can kick this virus to the curb, including the variants, and you'll be, protected from both. These are COVID measures to keep you safe.
Have you checked out any of the vaccination centers?
I will be. I have yet to go. We are in committee week this week, and for those watching, that means we start at 9:30. We take a brief break, go till 4, pick up again in the evening, and go till 10. So that was my evening yesterday. That's my day tomorrow. That's my day on Thursday. So I'm doing the business of the city right now, but as soon as I can get up and out, I will be dropping by for sure.
I like how you're taking a break right now talking to me.
This is my time off right now. This is supper for me. That's all right. While the sun is still shining, I'm gonna try and get a walk in too. And
Okay.
a bit of food.
We're almost done. Don't worry. Okay. How has the red zone been with the businesses in Burlington? Have you talked to them? What are they saying?
Well, the biggest issue right now is in our hospitality sector. And that's because of that hard cap that we've talked about many times. We've advocated multiple times, sent letters to the Premier, raised it on calls, and not just us. Mayors across the province have communicated this message that they need to lift the cap. It should be based on capacity, on square footage. That would help our restaurants, our banquet centers, all of those businesses that have really taken the brunt of COVID-19. They're the ones that are suffering the most, and they're the ones that are going to see the longest recovery, 2 to 3 years probably, to get back to anything resembling where they were before the pandemic hit. So that is a huge concern. Also in the hospitality industry, they're having trouble getting insurance. There are premiums that are 20 to 30%. Our local MPP is right in on that and working to see what she can do about that. Also, we have very antiquated liquor laws in Ontario. No surprise.
Yeah.
But the restaurants, you may not know, pay the same as you and I do for a bottle of wine. There's no wholesale discount. And so that's an easy fix.
Yeah.
That is a really easy fix to allow wholesale purchasing, because that's what every other industry is like. So those are some of the things that actually the businesses brought forward in a session that I had about 2 weeks ago. Almost 60 of them on the call, and we're identifying all their issues, and some were provincial, some were municipal. But today at our committee meeting, and we'll ratify it tonight at council, we passed a resolution asking them to fix, LCBO, asking them to look into the premium issue, and asking them to fix the hard cap. So we're going to keep pushing that and hearing from our businesses, but it's really tough. They are just hanging on. And what they're seeing, we talked about vaccination hesitancy. What they are seeing is consumer hesitancy.
Yeah.
People worried about coming back out into a restaurant. And, you layer on top of that our medical officer of health has recommended, at least for now, that if you go to a restaurant, you go with people that you are related to, that you're living with, people in your own household. So I think there's a lot of hesitancy for people to come out, and the restaurants are seeing that even if they're open and they have space, there's not necessarily some uptake. So they're looking at doing some dedicated consumer confidence campaigns.
Okay. You're talking the restaurant industry or Burlington doing restaurant campaigns?
So our tourism, Burlington. So they're one of our Team Burlington affiliates. That includes our ECDEV, our two BIAs, Downtown and Aldershot Tourism, and of course the Chambers. So those have formed, it's been in existence for a long time, the Team Burlington umbrella. They work very closely together. So Tourism Burlington was on the call that I mentioned with the hospitality industry. They're working very closely with the Burlington Restaurant Association to put together, for lack of a better word, the consumer confidence campaign.
Okay. And sorry, did you say that it is a hard kind of rule that says you have to go out with family members, or is that more of a suggestion?
That is a recommendation. It is not a regulation. It's not a regulation. And I know that in and of itself has been a source of concern and confusion in the industry. People are not sure what's law and what's guidance. If restaurants want to kind of impose the guidance and limit people and ask for IDs at the door, they're getting a lot of flack and a lot of pushback from their customers. So we talked about that actually at length at our committee meeting, and heard from our ECDEV folks that they believe the province really needs to step in and set some, across the board standards, regulations, so that no one business is singled out if they go above and beyond to try and keep themselves and their customers and their staff safe. It's really kind of still ugly out there. We need an extra dose of kindness all around, and understanding and recognition that different businesses within the rules, different businesses will go above those, and some will not feel the need to, and some tolerance would be really nice right now.
True. I can't wait to eat in Burlington soon. So here is a question. I'm going to have to read this because it's pretty kind of inside baseball. Applications for building permits for sheds and backyard swimming pools are now open for Burlington residents. Are there concerns that not all applications will be reviewed on time due to COVID-19?
It's a great question, and actually we have an online system. All of our staff have been working remotely, so we're all set up to receive the permits. What we've seen though is a tenfold increase in the demand of the number of applications. So we know about that. We're looking to resource that and to provide some help to make sure that we can still meet, we can satisfy everybody, because everyone's home, right? Nobody's traveling, and thank you for that. Everyone's home and renovating. And so there's lots and lots of work going on in community, and we're going to be ready to make sure that we can process all the permits come in. So
no delay or a little bit delay?
They're going to work really hard to make sure everyone gets a permit. Okay. The goal is no delay. So let's aim high and get close to it.
Okay. The city of Burlington recently announced that they are replacing 13 playgrounds over the next 2 years. Tell us a little bit more about this decision.
So playground equipment has end of life, believe it or not. So at some point you have to look to replace it. And when we do, we ask the community to help us in terms of, sky's the limit at that point. We don't have to just replace the same thing that was there. If people are looking for new types of equipment, if there's new things that are on the market that people like, that's the time to engage and say, could we have this, or could we have, whether it's swings or whether it's, certain kinds of climbing structures. There's lots of really neat things that are out there. So there will be a whole menu of options that people can weigh in on and, really, really help to design what's going to be the future of the park in their neighborhood.
Do you remember the parks a long time ago? They were all metal and and they used to get really hot in the summertime, like scorching hot and burning.
Well, I'm old enough with my kids to remember when there were wood structures. My kids would get
I remember that too. I remember that too.
Remember that?
Yes,
The big, there was like a big pirate ship and, a big boardwalk up in the air. And anyways, yeah, we don't do wood anymore, and we don't much do metal either.
I say more zip line, okay? Like the zip line at is it Spencer Smith Park?
There's a zip line at Spencer Smith that has been loved and hated because people, if they're not paying attention, and somebody's swinging, we just have to ask people to be careful. But
you have a video
like
there.
Anything.
So
it is cool. That it was people loved it, but you got to be careful. I think people have figured it out now. It's been there long enough.
Okay. So those are all my questions. Is there anything you want to talk about, add, or anything, or do you want to just take a break for a couple of minutes and then your other meeting?
Well, we are. I don't know if there's anybody from Millcroft on the line here watching, but we had the first of several statutory public meetings on the proposal for Millcroft Greens. Of course, it's a proposal to redevelop parts of that golf course. We had a community meeting that started at 1 o'clock yesterday and went with a small break right till 10 o'clock. And we got through half of the registered delegations. We'll be back at it again tomorrow at 1 o'clock, right through to the evening. And we've got a spot even next week if we need to go over. We want to hear from everybody in the community. I can say that universally, the residents are not in favor of any development on the golf course, which currently is zoned open space. And they were quite eloquent, actually, and very well researched. They've done some history, and they came to talk about the personal impact. And we had some young folks, some teenagers and younger, come and talk to us, and that was awesome. So my message out to everybody is that it's never too young to engage with your elected representatives. It's never too young to get involved in civic issues, and it was really great to hear those voices alongside all of the others. So round 2 is tomorrow and maybe round 3 next week. We're not making a decision on the application. It is, the recommendation is simply to direct our staff to continue working on it because not all of the technical comments and review of studies has been complete. So we'll see where that goes. There were some suggestions made that I think are worthy of some consideration about possibly getting some interim review of this application, but staff are saying roughly by September they think they'll bring back some sort of a recommendation report. And that could be to refuse the application outright. It could be to accept parts of it. There's 5 different areas that are being proposed for redevelopment. So they may say some are okay and some are not, or they could approve it or recommend approval. So any of those options are on the table as a recommendation. Then it's in council's hands temporarily, because of course anybody can appeal a decision they don't support to the local planning appeal tribunal. So either the applicant could do that or the residents group could do that. So it's a big file and it's still got a lot a lot in front of us on that, but I did want to take a moment to just say how grateful I am to the community for investing the time. Their input really has been invaluable through this process, and we've gotten the message loud and clear where they're at.
Cool. So I gotta ask, when you're on Zoom calls all day, like at one meeting, do you keep your camera on, or does it just, do you turn it off and it just says your name sometimes?
I mostly keep it on. Sometimes because we're all working from home, as you know, I'm working from home. Someone's got to let the dog out.
Yeah.
So I take the meeting with me, let the dog out, and come back. So I turn it off for that rather than give people a tour of the house. So yeah, and but mostly we all keep it on so that they know that we're there and that we're paying attention. Just
Nice.
like if it was live. I know it's a little different, but you know, when you're at a real meeting, you're kind of captive there too. So
Yeah, of course. Yeah. Anything else you want to talk about?
I think we've covered it.
Yeah. Okay. All right. Well, hope you enjoy the rest of your other meeting.
Round 2 at 6:30. So got a bit of time to take a walk and have some supper.
All right. Thank you so much. I'll see you
Thanks
next
a
week.
lot. Take
Okay.
care. Bye-bye.
Bye.